Hi guys, it's Dr. Armagan again. Just coming back with some more information and answers to your questions on our discussion board. It's been really interesting. Lots of stuff going on in New York. We're seeing a lot of patients, a lot of infections. And again, some of the questions are, why are we seeing so many different ranges, such a big range of illness severity in people? And again, it was a question about why are some people, like the elderly, more in danger, or people with diabetes and high blood pressure, why are they experiencing or in danger of experiencing more severe disease symptoms? So these are some of the topics we'll talk about today. So just a little backstory, just to remember about these details. It seems like so long ago that we learned about this COVID-19 or the coronavirus. Started in late 2019 in Wuhan, China, as a cluster, a small group of pneumonia cases that didn't have a known cause. And it was later determined that the cause of these pneumonia cases was a new virus. And that new virus was called Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. This is the illness that causes COVID-19. So this has been declared a pandemic by the World Health Organization, and the majority of people who are infected with COVID-19 only suffer mild cold-like symptoms, but then there are others who are severely ill. The World Health Organization says about 80% of people who are infected with COVID-19 recover without needing any kind of specialized medical treatment. And about 1 in 6 people become seriously ill and develops difficulty breathing. Now, that's still a lot of people, 1 in 6. So how does COVID-19 develop into a more serious illness where pneumonia is prevalent? And what does that do to our lungs and the rest of our body? And how is the virus affecting people? Almost all of the serious COVID-19 cases involve pneumonia. So people who catch or are infected with COVID-19 are grouped into four categories. So the first category are those people who are the least serious. That is, they are subclinical. They have the virus, but they don't have symptoms. Then there's a second group. They do get an infection in the upper respiratory tract, which means that they can have a fever or cough, or milder symptoms like a headache. And these minor symptoms, even with these minor symptoms, they're still infectious, and even though they may not be aware of it. The third, the largest group of people who are positive for COVID-19, they're most likely the ones who are going to go to the hospitals. They develop like flu-like symptoms, and those symptoms are strong enough, severe enough that they would want to stay home from work, or they should stay home from work. And the fourth group are those that develop severe illness, where pneumonia is prevalent. So the World Health Organization says that elderly and people with underlying problems like high blood pressure, heart and lung problems, or diabetes are more likely to develop serious illness, those people in the fourth category. So how does this pneumonia develop? So when people with COVID-19 develop a cough and fever, this is a result of the infection reaching their respiratory tree, the branches of their respiratory system. And that's the air passages that conduct air between the lungs and the outside. So the lining of this respiratory tree becomes injured, causing inflammation, and this in turn is going to irritate the nerve in the lining of the airway. And in this case, just a small speck of dust can stimulate a cough. But if this gets worse, that means that infection has gone past the lining of the airway and gone into the gas exchange units, which are at the end of the air passages. And if if those areas of the lungs become infected, they respond by sending out lots of inflammatory material. Remember those cytokine storms I talked about in video 5? And so all of this inflammatory material is sent by your immune system to the air sacs that are at the bottom of our lungs, the lower respiratory tract. And if the air sacs then become inflamed, this causes an outpouring of inflammatory material, fluid, inflammatory cells into the lungs, and we end up with pneumonia. So then the lungs are filled with inflammatory material. Those patients are unable to get enough oxygen to the bloodstream, right? Because blood carries oxygen, and this reduces the body's ability to take in oxygen and get rid of carbon dioxide. And that's the usual cause of death with severe pneumonia. And how can this pneumonia be treated? Unfortunately, so far we don't have anything that can stop people from getting COVID-19 pneumonia. People are trying all kinds of medications and various combinations of antiviral medications, and that hopefully can be effective, but at the moment there isn't any established specific treatment apart from support treatment. That's what we give people in ICU. People are put on a ventilator to maintain high oxygen levels until their lungs are able to function in a normal way again as they begin to recover from the virus. But patients with viral pneumonia are also at risk of developing secondary infections. So they would be treated with antiviral medication and antibiotics like azithromycin and hydroxychloroquine. That's what we talked about in video 5. So in some situations, that isn't enough. The pneumonia is uncontrollable and the patients don't survive. So how come COVID-19 pneumonia is so different? COVID-19 pneumonia is different from most cases in that people are usually admitted to the hospitals for, because most types of pneumonia that we know of and that cause people to be in the hospital for are bacterial pneumonia, and those types of pneumonia can be treated with antibiotics, but COVID-19 can't. So there is evidence that the pneumonia caused by COVID-19 is particularly severe, and it seems that cases of coronavirus pneumonia tend to affect all of the lungs instead of smaller parts of the lungs, like other types of pneumonia. Once we have an infection in the lung, and if it involves the air sacs, then the body's response is to first try to destroy the virus and limit its replication. And this is the first responder immune response. And it can be impaired in some groups, like the elderly, people with diabetes, people who have lung conditions, and people who are immunocompromised, So, so age is a major predictor of risk of death from pneumonia, and it's always serious for an older person. And in fact, it's used to be one of the main causes of death in the elderly. And it's important to remember that no matter how healthy and active you are, your risk for getting pneumonia increases with age. And this is because as we age, our immune system naturally weakens, making it harder for us to fight off viruses, illnesses, diseases. So we want to really look out for those, elderly people, those people who are weaker than us. It seems counterintuitive because you would want to take care of them, be with them. But the best thing you can do is to really stay away, isolate yourself. So the people that you care about, your parents and grandparents, small babies, people who are immunocompromised, who have these underlying health conditions to begin with, you don't want to potentially unknowingly infect them with the virus, because you may be feeling quite healthy and okay. So anyway, guys, hope all is well, and we will talk again soon. Keep those questions coming. Bye.